I'm John Stanley. I'm a maternal-fetal medicine specialist. I practice with the Perinatal Center. We have offices in Norman. We have an office at Baptist Medical Center in Oklahoma City. We have an office at Mercy Health Center in Oklahoma City. We have an office at St. John's Medical Center in Tulsa, and I also practice at Hillcrest Medical Center in Tulsa. Our other office is in Rogers, Arkansas, in association with Mercy Health Center. Your LMP is your last menstrual period, and the most important thing is to remember the first day of your last menstrual period. It's also important how often you have a menstrual cycle. Are they 28 days apart? Are they 35 days apart? Are they 21 days apart from the start of one to the start of the next? That helps us to know when you ovulate, because you ovulate 14 days prior to the start of your menstrual cycle. No, your due date shouldn't change once we've determined your best due date. Your due date is based on the first day of your last menstrual period. Your due date is 280 days after the date of the first day of your last menstrual period, but that's assuming that your menstrual cycles are 28 days long and that you ovulated 14 days after the first day of your last menstrual period. If your menstrual cycles are longer than 28 days, then you ovulated later than 14 days after the first day of your last menstrual cycle. And if your cycles are shorter than 28 days, then you ovulated less than 14 days after the first day of your last menstrual period. So initially we base your due date off of that, but many times women don't remember their first day of their last menstrual period, or their menstrual cycles are irregular, and so it's not very accurate. In that case, it's important to have an ultrasound early in the pregnancy. An ultrasound in the first trimester, less than 12 weeks gestation, is accurate to within 5 to 7 days at predicting your estimated due date. The ultrasounds later on in the pregnancy become less accurate. Up until about 20 weeks gestation, your ultrasound is within 10 days to 14 days of predicting your due date. And then after that, it's anywhere from 14 to 20 days accuracy at predicting your estimated due date. A lot of times people think that their due date changes every time they have an ultrasound done later in the pregnancy, but the later ultrasounds in the pregnancy are not as accurate as the earlier ultrasounds in the pregnancy. So once your due date's been confirmed by an early ultrasound, your due date won't change. What we're doing in estimating your due date by those later ultrasounds is we're saying, if your baby were exactly at the 50th percentile or in the middle as far as size goes, this would be your due date. Not all babies are right at the 50th percentile, so the later ultrasounds give us an idea more of whether your baby's growing smaller or larger than normal. If your due date by ultrasound is measuring different than your due date by last menstrual period, then the ultrasound is more accurate if it is within 5 to 7 days at less than 12 weeks along, or within 10 to 14 days at less than 20 weeks along. The later ultrasounds are plus or minus 14 to 21 days, so they're not as accurate. A full-term pregnancy is 40 weeks from the first day of your last menstrual period. You're actually only pregnant for 38 of those weeks, but we count 40 weeks starting at the first day of your last menstrual period. You actually get pregnant 14 days after the first day of your last menstrual period when you ovulate and conception occurs. The best time to get your first ultrasound to find out when you're due is probably around 7 to 8 weeks gestation. At that time, we can see what we call a crown rump length. The baby looks a little bit like a bean, and we measure from one end of the bean to the other end of the bean. The other important thing at that point is that we can see a heartbeat and know that the pregnancy is progressing normally. Those ultrasounds anywhere from 6 weeks gestation up until about 12 weeks gestation are within 5 to 7 days in predicting your due date. So that's the most accurate time to have the first ultrasound done. Another good time to have an ultrasound done would be around 12 weeks along, because it's pretty accurate at determining your due date, but we can also look at the thickness of the nuchal translucency, the area on the back of the neck. A thickened area on the back of the neck is associated with an increased risk of genetic abnormalities or birth defects such as cardiac abnormalities, and so it's nice to look at an ultrasound at that point in the pregnancy to kind of see that everything is normal. Another good time to do an ultrasound during pregnancy would be around 18 to 20 weeks of pregnancy. At that point, we can look closely at the anatomy of the baby and make sure that there are no abnormalities of the baby. The other thing about that point in time is it's still fairly accurate in determining your due date. So if you haven't had an ultrasound done, that's a good time to do it. And the most important thing is you can tell whether it's a boy or a girl around 18 to 20 weeks along in the pregnancy. Sometimes you can tell earlier than that, but definitely by 18 to 20 weeks in the pregnancy, we can tell whether it's a boy or a girl. You really can't tell whether your baby is going to be early or late. The general idea is that if you know your due date, that 80% of people will deliver in the time period from 2 weeks prior to their due date to 2 weeks after their due date. In today's situation, though, we usually don't let people go beyond 1 or 2 weeks past their due date. So most people tend to deliver a little bit earlier than their due date or just right after their due date. If you are allowed to go into labor on your own, the most likely time that you would have the baby would be on your estimated due date. It's also important to know when determining your due date, if you know when you ovulated. That's because we can usually determine your due date based on that more accurately than the first day of your last menstrual period. Also, if you only had intercourse and that's the only possible time you could have gotten pregnant, if you know that date, it's helpful. So we use whatever information we can in coming up with the best estimation of your due date. But we're never 100% in predicting your due date and when you got pregnant.